Welcome to your prenatal education with Sagwa MPG. We are so happy that you're here and excited to share this journey with you. First off, we just want to say congratulations and thank you so much for choosing our practice to care for you and your baby throughout your pregnancy. Our goal is to educate and prepare you for what to expect throughout your pregnancy with Sagwa MPG. So, what are we going to cover? In the next 30 minutes, we will introduce you to your care team, provide you with your first trimester education, and prepare you for what to expect during your pregnancy. During this time, we ask that you please write down any questions you have to discuss with your provider at your first appointment. All right, so let's get going. Let's meet your care team. This is Dr. Annie Bordalio. She is Guam's first OBGYN. She is the founder and owner of Sagwa MPG. You may see her in clinic or at your delivery.
Who can you expect to see at your prenatal appointments? Sagwa MPG is a group practice, so you can expect to see each of these providers at least once during your care. We have one certified nurse midwife, Christina Anciano, and two physicians, Dr. Berdalio and Dr. Coquen. Who will catch your baby? We have one certified nurse midwife, two physicians, and several hospitalists who help our providers deliver our Sagwa MPG patients at GMH. Sagwa MPG is the only OB practice to have its very own registered dietitian nutritionist, Lenora Matsanani. She is a wealth of knowledge and information related to all things nutrition in pregnancy. She provides medical nutrition therapy for chronic conditions such as diabetes in pregnancy. Our patient educator, Barbara Mofnis, has been with Sagwa MPG for over 20 years. She is a master's prepared registered nurse with expertise in education and breastfeeding. She is a board-certified lactation consultant and offers complimentary one-on-one breastfeeding consults for all of our MPG patients. Barb also teaches several patient classes that you may sign up for at any time. Here's a list of all the classes with a suggested timeline for your pregnancy. You'll notice Lamaze, parenting safety, baby daddy class, and much more. She even offers a GMH orientation and C-section class for those who want to be better prepared for their delivery. Please feel free to scan the QR code to see a list of all her classes. This is also her phone number for your reference. She encourages patients to reach out with any concerns they may have.
All right, so let's talk about your first trimester. The first trimester is conception to about 13 weeks of gestation. This includes months 1, 2, and 3 of your pregnancy. Normal body changes that you may notice during your first trimester include the following. The first symptom that you'll likely notice is that your period stops, although some women experience some spotting in the first trimester. You may notice that your breasts are more swollen and tender. Some women experience nausea and vomiting and feel more tired. You may be peeing more frequently, have light cramping. You may gain or lose weight, experience headaches and backaches. You may have mood swings, food aversions, and increased gag reflex, or you may be disinterested in food. Some women are extremely hungry and they have an enhanced sense of smell. Some women have an increased libido, and some women have decreased libido.
Here's a list of concerning changes and when you should call us. If you have any questions regarding these symptoms or others not mentioned, you can contact our nurse triage line during clinic hours. You may call the clinic and select option 3, anytime between Monday and Friday, 9 a.m. to 5 p.m. So let's talk a little bit about what you can expect for your first visits to clinic. Your very first visit to the clinic will be a nurse visit intake. This visit will be busy. You will complete registration paperwork if not done ahead of time, meet with our informative billing department, and have a full history intake with one of our experienced nurses. You will have your weight and blood pressure checked as well. You will answer questions about your personal and family history, as well as past pregnancies. High-risk conditions will be reviewed and the proper labs and imaging will be determined. You will be given a prescription for prenatal vitamins. After your intake, you will be sent to the lab to complete your prenatal labs. Your second visit will be with one of our skilled OB providers. Prior to this visit, they will have reviewed your history and lab results and will discuss any abnormal findings or concerning conditions that may affect your pregnancy. They will also answer any questions you have after watching this video. You will have a complete physical exam, including a breast exam and pelvic exam, which will screen for cervical cancer and HPV if needed. You'll be offered a PPD test to screen for tuberculosis. And if you are far enough along in your pregnancy, you will also get to hear your baby's heartbeat. We do offer 2 optional tests to screen for genetic abnormalities your baby may be at risk of having. One test is called the Clara test, which can be done as early as 10 weeks and screens for Down syndrome and other chromosomal abnormalities, as well as sex chromosome abnormalities. The other test is the quad screen. That can be done between 15 to 20 weeks and screens for Down syndrome and other chromosomal abnormalities, as well as neural tube defects, such as spinal bifida. These tests may be recommended if you are at higher risk or you are above the age of 35. These are screening tests only, and if they come back positive, further testing will be offered to confirm whether your baby does in fact have the condition. If you are considering these tests, you should speak with your insurance carrier about whether they cover genetic screening tests in pregnancy and which one.
Up until 28 weeks, which is about 7 months of your pregnancy, you can expect to have an appointment every 4 weeks. At each of your appointments, your provider will check your fundal height measurement. This measurement is the distance between your pubic bone and the top of your uterus. This measurement is important because it allows your provider to know if your baby is growing appropriately. They will also check your fetal heart tones with a Doppler. It's important to wear 2-piece clothing so that your provider can have easy access to your stomach. They will check your blood pressure and check your weight. Special dates to remember is that when you're nearing 20 weeks of gestation or about 5 months pregnant, you will get a referral for your anatomy ultrasound. This ultrasound is exciting because you get to see all of the baby's major organs, such as the brain, the heart, lungs, and stomach. This ultrasound will tell your doctor or your provider whether or not the baby is growing appropriately. At 26 to 28 weeks, you will also get tested for gestational diabetes. This is done by drinking a sugary drink and having blood work done 2 hours after to make sure that your blood sugar is within normal range. From 28 weeks until 36 weeks, which is about 9 months pregnant, you will have an appointment every other week. So this is your third trimester. You can expect to see your provider every other week. Around 28 to 32 weeks, you'll get additional blood tests done to check for anemia. So anemia is actually very common in pregnancy. It is when your body does not have enough healthy red blood cells. These cells are very necessary for providing the tissues in your body with oxygen. At 36 weeks, we do a GBS swab. GBS is an acronym for group beta strep. Group beta strep colonization is not an STI. About 25% of pregnant women are actually colonized with GBS in the rectum or the vagina. So most women actually don't know that they have it because there's no symptoms. If you are GBS positive, you'll be treated with antibiotics in labor to minimize the risk of the baby coming into contact with the bacteria and having complications because of it. This test is done by taking a swab and swabbing your rectum and your vagina. You can either do this test yourself or you can have the provider do it for you.
At 36 weeks, you will also receive a pink sheet with labor precautions and instructions, as well as postpartum precautions and concerns. You can also find these 24/7 on our website under Patient Resources.
From 36 weeks until birth, you can expect to have an appointment with your provider every single week.
Nutrition during pregnancy. Let's talk about the importance of prenatal vitamin and mineral supplements, balanced eating patterns, some helpful nutrition tips, weight trending, exercise, and food precautions. Why is a prenatal vitamin so important? To start, it's called a prenatal vitamin for short, but it's really a multivitamin and mineral supplement with nutrient amounts to support additional needs of your body during pregnancy. This supplement has two nutrients of particular interest, which are iron and folic acid. Iron is a mineral that helps reduce the risk of preterm labor and low birth weight, while folic acid is a vitamin that reduces the risk of neural tube defects. Though many foods contain these nutrients, a supplement helps to bridge the gaps between what you need and what you're eating and drinking. It may also be helpful to take your prenatal supplement with citrus fruit or berries, as the vitamin C contents in these fruits increase the absorption of iron in your body. Having a balanced eating pattern in pregnancy is super important. We encourage you to eat small, frequent meals throughout the day and to avoid skipping meals, as doing so may trigger heartburn in pregnancy and may lead to excessive calorie intake in the evenings. Nourishing for two is different from just increasing portions of the same foods to eat for two. Be mindful of consuming all food groups daily while practicing moderation of deep fried foods, highly processed meats, and high convenience or instant foods, as they're typically high in added sugar, sodium, and saturated fat. Rather, include high quality protein foods in all meals and snacks to satisfy hunger and meet the needs of your body during pregnancy. This includes lean meats, fully cooked eggs and fish, seafood, beans, nuts and nut butters, tofu, dairy or soy milks, cheese, yogurt, and cottage cheese. And lastly, avoid sugary drinks and drink plenty of water. During your pregnancy, give your body the nourishment to support baby's growth and your own energy by incorporating vegetables, fruit, protein, whole grains, milk, and soy products throughout the day. You can seriously reduce your risk of developing gestational diabetes and other possible complications by limiting sugary drinks, high sugar foods, and large starch portions. You can also reduce heartburn symptoms by eating small, frequent meals throughout the day instead of 2 to 3 larger meals, and by spreading out your water drinking throughout the day. Weight gain is a natural part of pregnancy. Gestational weight gain recommendations vary and depend on pre-pregnancy body mass index, or BMI. Women considered overweight or obese before getting pregnant have lower weight gain recommendations than do women with a normal pre-pregnancy BMI. Your provider will let you know which category you fall under and how much weight you can expect to gain during your pregnancy. To give you an idea of what this weight trend might look like, pregnant women with a normal BMI pre-pregnancy should average about 1 pound of weight gain per week in the second and third trimesters, while those considered obese based on pre-pregnancy BMI should average about half a pound per week. These estimates do not account for any significant weight gain in the first trimester, however, as calorie needs don't increase compared to pre-pregnancy needs. Managing pregnancy weight gain supports the delivery of a healthy weight infant and improves the long-term health of both mommy and baby. Exercise in pregnancy. If you're healthy and your pregnancy is normal, then it is completely safe to continue or start regular exercise. Exercise does not increase your risk of miscarriage, low birth weight, or early delivery. Low impact exercises such as swimming, walking, yoga, and prenatal workouts on YouTube are wonderful options to try. We encourage you to strive for 30 minutes a day, at least 5 days a week. There are lots of benefits to exercise, especially in pregnancy. It can help ease your constipation, reduce the risk of pregnancy complications, and support healthy weight during pregnancy.
These are some precautions that we encourage you to make sure that you're paying particular attention to. We try to tell you to avoid unpasteurized milk or food containing unpasteurized milk. Also, soft cheeses like brie, feta, or queso blanco, these can have bacteria in them that are not safe for you and baby. Foods high in mercury, such as swordfish, shark, or marlin, improperly processed deli meats, raw or undercooked seafood, eggs, and meat. Caffeine is safe, but we tell you to limit it to less than 200 to 300 milligrams per day, which equates to about 2 to 3 cups of coffee. What should you absolutely avoid in pregnancy? We encourage you to avoid changing the litter box. If you have someone else in your family or household who can do this, please delegate that. We also encourage you to not garden without gloves on. There can be harmful bacteria in the soil that can harm you or your baby. Do not take NSAIDs or aspirin during pregnancy. This includes Motrin, Advil, ibuprofen, and Aleve. Hot tubs and saunas are not safe. This can lead to an increase in body temperature, which has been associated with an increased risk of neural tube defects and other congenital anomalies. You also should avoid alcohol and smoking. So, what is okay in pregnancy? If you are experiencing aches and pains or you have a fever, taking Tylenol is completely safe. If you enjoy gardening, make sure you're gardening with gloves on. And you can also take tub baths and swim in pools. So let's talk a little bit about sex. Is it safe? Absolutely. Will it harm your baby? No, it will not. In the absence of pregnancy complications, there is insufficient evidence that sexual intercourse in pregnancy is dangerous. Most studies actually show that there's no increased risk of preterm birth or infectious complications unless you do acquire an STI in pregnancy. If you should abstain from sexual intercourse, your provider will certainly let you know. I also want to stress that it's completely normal to have increased or decreased libido in pregnancy. Some women feel extra confident when they're pregnant, and some women just don't. Both are completely normal. So let's talk a little bit about dental care. Dental care in pregnancy is extra important. You are at increased risk for cavities and gum bleeding during pregnancy because of your excess hormones. Eating more carbs during pregnancy gives bacteria the extra food to grow and cause tooth decay. Morning sickness can also actually increase the acidity level in your mouth, which can cause harm to your tooth enamel. Lots of women develop something called pregnancy gingivitis. This causes swollen, tender gums that may bleed when you brush or floss. Higher hormone levels affect the way that your gums react to plaque. So we encourage you to brush your teeth 2 times a day for at least 2 minutes, floss once a day, and make sure you're drinking plenty of water in between meals. Let your dentist know that you are pregnant. Make sure that you keep regular cleanings every 6 months and get cavities treated as soon as possible. Numbing medication is completely safe for you and the baby because it acts locally in your mouth and does not affect you systemically. Environmental and work hazards can cause negative health effects such as miscarriage, stillbirth, and delayed fetal growth. It's important to let your provider know if you have work or you are exposed to chemicals frequently in your work or your daily living. These chemicals or hazards include mercury, lead based paints, pesticides, environmental tobacco smoke, products containing chlorine, or organic solvents in cleaning products, cosmetics, and aerosol sprays. A teratogen is an agent or a factor which causes malformation of an embryo. Some known teratogens include certain medications, street drugs, alcohol, tobacco, toxic chemicals, some viruses and bacteria, and certain health conditions like uncontrolled diabetes. This is a list of safe medications in pregnancy. During your pregnancy, you may have pain and fevers. You may get a cough or a cold. Lots of women have GI issues such as heartburn, diarrhea, constipation. Some women have allergies. And these are just a list of medications that are safe for you to take during your pregnancy to help with these symptoms. Pregnancy is associated with an increased risk of severe infection. So, why is this? It's because your immune system in pregnancy is actually weakened. These vaccines are safe in pregnancy, and you should stay up to date on them during your pregnancy, not only to protect yourself, but also to protect your baby. We encourage you to get the COVID-19 vaccine, the flu vaccine, and the Tdap vaccine. The COVID vaccine is safe in pregnancy, And the percentages here that you see are actually the percentage of effectiveness against severe infection requiring hospitalization. So the Moderna vaccine is 93% effective against severe infection requiring hospitalization. This was a study done by the CDC in 2021. The flu vaccine is safe during pregnancy anytime. And the Tdap vaccine, which protects against whooping cough, we encourage you to get that vaccine in the third trimester. If you have other people in your family that are also going to be in close contact with your baby after delivery, we encourage them to get this vaccine as well. So, how can you protect yourself against infection? What's important to remember is that you use consistent, good personal infection control practices throughout pregnancy to help reduce your risk of infection. So, this includes hand washing and cleaning surfaces, washing your fresh fruits and vegetables, using protection during sexual intercourse, such as condoms. Toxoplasmosis is extremely toxic to a baby. So, this is ingesting contaminated or undercooked meat, soil that's contaminated on your fresh fruits or vegetables, or even contaminated or unfiltered water. This can cause miscarriage, stillbirth, and preterm birth. Cytomegalovirus is a virus that is passed from you to your baby, and it puts the baby at an increased risk of congenital birth defects and developmental disabilities. The best way that you can prevent this viral infection is to practice good hand hygiene, especially when you're in contact with diapers or oral and nasal secretions of young children, and make sure that you're cleaning countertops frequently. So, what is the best sleep position during pregnancy? The recommendation actually used to be to avoid sleeping on your back. And this was thought to be because the weight of the baby and your uterus would compress large blood vessels that would decrease the blood supply to you and your baby. So, actually, to date, there is no significant studies that indicate that back sleeping increases the risk of stillbirth. So, based on this information, we actually recommend that you sleep however you're comfortable. If that includes being on your back, then go for it. You can also purchase these helpful body pillows that are very helpful to get you in a comfortable sleeping position. Intimate partner violence is extremely sensitive topic in pregnancy. It is the abuse or aggression that occurs in a romantic relationship, and it does happen in pregnancy and postpartum. It actually may escalate during these times because these times can be very stressful for couples. It is associated with adverse maternal and pregnancy outcomes. And it's important that if you're experiencing this in your relationship, to talk to your provider if you're not feeling safe. This violence is not always physical. Sometimes it can be in the form of, stalking or sexual violence. It can also be psychological. Sometimes it's not even with the partner that you're currently with, it could be with a past partner. Wearing your seatbelt is the single most effective action that you can take to protect yourself and your unborn baby in a car crash. We highly recommend wearing your seatbelt through all stages of your pregnancy. Try to avoid letting your belly touch the steering wheel if you are the driver. Make sure that your shoulder belt is across your chest between your breasts and the lap belt is secured below your belly so that it fits snugly across your hips and pelvic bone. Our providers recommend not going anywhere far after 32 weeks. This is because this is the biggest risk with this is that you'll go into labor and you'll be getting care from people who don't know you personally, they don't know your medical history, and they don't know your baby. So we recommend that the best time to travel is between 14 and 28 weeks. And this is your second trimester. It's important that if you have planned travel coming up to let your provider know. And we encourage you to wear compression socks during long travel to prevent swelling of your lower legs and drink lots of water. If you're still breastfeeding another baby, we want you to know that this is completely safe, especially if you have an uncomplicated pregnancy. Your milk supply will likely drop, but you will not dry up completely. If you have complications in your pregnancy, you may be advised to stop breastfeeding, as this can cause contractions in pregnancy.
Hi, patient education is important because it will empower you. It will give you knowledge and skills and confidence to go through your pregnancy and your birth. If you want to learn more about our classes, go visit our website or call the clinic at 6.
And with that, we want to say thank you so much again for choosing Sagwa MPG, and we are so excited to share this journey with you.